I truly believe that we are on the right model and at the right time for America.
The greatest promise of the patient-centered medical home is that it will organize your work to ensure that we can do ours. That employers and health plans and physicians and nurses and administrators work to ensure that each of us can effectively perform the actions that we must take.
We have deliberately spent more money on primary care with malice aforethought, choosing to do so, and our result is that our overall costs are dramatically lower.
Most importantly, those principles are really around a common set of practices that the docs and the patients, the consumers, have asked for in terms of the care that they would want for themselves and their mother.
So actually the reshaping of the primary healthcare team is quite important here. Breaking GPs in the UK out of their traditional role of simply seeing patients for 2 minutes, giving them a prescription and telling them to push off and then not monitoring what happened was one of the key elements of this reform.
80% of the family doctors of Spain work directly with the computer. So we don't have papers, or at least few papers. That is good for the doctor, it's good for the patient.
The time is now, and now is when the hard work really begins, and we roll up our sleeves to move the healthcare system and change our current paradigm.
So it's going to be critical that those of you who have experience in the development of patient-centered medical homes talk to Congress exactly about how you would amend the Medicare statute to reimburse physicians and practice groups for patient-centered medical homes.
The same people that signed on to the medical home principles are the same people that are really going to have to hone this message in on different members of Congress moving forward.
I also just want to point out that the campaigning doesn't stop on Election Day. I mean, I think you're all here because you're engaged in a really long-term campaign about medical homes and making quality of care better for people in this country.